You ready? All right, so we're about to scrub for surgery. My resident's gonna do it real quick. You gotta scrub all on the hands. Let's get in between. You gotta get on the arms and all that stuff. While you do that, I'm gonna go check out our mother in here. In the meantime, I'm gonna get some stare down for our
Oh, hi there.
Here we go. Just gonna put that on. So sterile technique really is a very important part of surgery right here. Now that our patient is now under anesthesia, here we go. Just like that.
Well, they do this.
There we go. IV secure. All good?
Yeah.
All right. These are sterile, by the way.
Oh, I could have done that myself.
You okay?
Thank you. You know, I think. Oh, yeah. Thank you. Yeah, just a little bit on that arm too.
I expect you to do the same for me.
Yeah, a little bit over. Yeah, there.
So we're gonna let your
more
hands.
this in?
You're gonna let your hands dry for just a second.
No.
No, you got to, because you will not be able to get the gloves on. So while those dry, I'm gonna scrub in, okay? Before that, I'm gonna open up our surgical drapes.
That person just died. Is that the anesthesia?
Yes.
Okay.
All right. We're gonna open up our steel drapes, just so when they're out, we can be able to touch them, because the outside is not sterile. There we go. Lay it down like that on the inside, the paper touching. All right, do you have the bar soap?
Right there. Why are you holding your hands up? You haven't cleaned it yet, so they're not sterile anyway.
No.
Looks
Get
stupid.
prepared. Shut up.
How did yours bubble so much?
I got it wet first.
I did that. Mine didn't bubble.
Central part of every surgery. Here we go.
Where's the oxygen?
Oxygen is getting through the liquid. Since he's a fairy, his physiology is a bit different.
Okay, that makes sense.
Yeah.
Alright.
Alright.
Ready when you are.
Alright. Get in between the fingers. Wash them. Dancing to the sound of the heartbeat.
Yeah. It's nice to beat.
Alright. Now, recorder, are you going to want to record the surgery? Like, are you still going to want to record the surgery? Alright, I got you. Just want to make sure. So we probably don't need a tripod then. Alright. Dr. Brayden, where'd you go? Consulting?
Yeah.
Alright, how are your hands feeling?
Cold.
Feeling dry?
Cold.
Cold? Are they feeling dry?
Sure. Where are my gloves at?
Your gloves are right there. You can pull them out. It's sterile.
No, usually they have. No, you gotta hold on. Take my glove. You gotta hold it.
Yeah, I know.
We'll do your gloves first. I already have.
But my hands are wet. So I got you.
You gotta take the glove?
Give me a sec. I'm drying.
Patient's dying. I said patient's thriving.
Okay. Are your hands still dry or wet?
No. You just suck.
right? Dr. Dad, Dr. Mom, okay about this? Alright. Oh yeah.
Where did you come at?
We got our student shadower in the room right now. Alright. In just a minute, when I get the gloves on, we're going to create the sterile field, okay? Good. Alright. I like your gold chain, Dr. Brayden.
I'm assuming you like all of it.
Yes, I do. Can you help me put my gloves on?
No. That's how you
Got
do
it.
it. You missed a finger.
I know, it's okay. If you get another one, I'll be fine. I'll go fix it. You're usually pretty good at that.
What hand is that? Perfect.
There
I'm
we
so
go.
good at that.
That was really
You need practice.
Alright, we're
High five.
sterile. Woo! Sterile high five.
Yeah. I think you spit on me a little bit.
That's okay.
Oh, you got a mask on. I don't got one. Nobody informed me.
Student, are you able to put a mask on our doctor real quick? You can put the camera down, like just face it up. And put a mask on him so he doesn't breathe all over our patient.
I'm clean.
He's clean.
Shower yesterday.
He's good. Area's clean. Area's sterile down here. You okay? Oh, the noise? Yeah, it's okay. Operating room has some strange noises. I'm setting up the sterile field. You haven't been trained on this yet. I'm going to cover the patient. I'm going to expose the area that we'll be operating on. Leave an area for the IV. Alright. Alright, now it's time to confirm the operation we are doing, okay?
Yes.
Brian, can you tell us about this case?
Jahevius. Voice box. Stop working. Doesn't work as well. Quiet. No sound. Cut open arm. Take out voice box. Put new batteries. Put voice box back in. Stitch back up.
Yes. This is Boogie Bear. He is a 2-year and 2-month-old bear who presents with electrochemical cell atrophy on the right side. Instead, we will be performing an electrochemical cell transplant in order to correct this. Can you confirm the MRN being 420 and 69?
420, 66.
42069. 42069 is an MRN, okay?
66.
It's not the 6. It's not the MRN, I promise you.
Did you check?
Yes.
I just checked it.
Oh my gosh. He's joking, of course. Alright. Alright, so we're going to be making the incision along here. So, Dr. Braden, I will lift up the skin for you. Would you like to make the first incision?
Yes.
Alright. So, I'm going to lift up the skin right here. I'm going to need you to be extremely careful, okay?
Am I just cutting right there?
Just make a very, 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 very small cut. Very small. I'm going to make a... I'm going to lift up again. I'm going to lift up.
Yeah, lift up harder.
Can you move the scissors?
No.
Don't cut too much. There we go.
There is an incision.
There's not an incision yet. We just cut off her. Let me show you. Do a little, just a little further back. Lift up here. Kind of gotta use
Scissors
the back.
don't work very
Gotta use
well.
the back end of the scissors.
Yeah? Thanks to the back end.
Try to make it loose.
You said a small incision, right?
Yes.
For sure.
This is sterile still. Come here, look. We're making progress at this end right here. You see?
Yes.
I'm just doing nuclear can. Take a look at that right there. You seeing this? So what we're gonna do is we're gonna go in. Another cut. We just gotta break this superficial layer right here. Now, maybe we can try to pull apart the skin just a little bit. Sounds like some suctioning is happening in OR3. Alright. See? Right. Resident.
Yeah.
Look at this. We got a little incision right here, so now that we were through the superficial layer, we'll be able to take a pair of scissors and cut through that end right there. If you want to make a very small cut, you might want to come on this side over here or do that.
Am I going that way?
Yeah. We're going to cut along this end over here.
The whole thing?
Not the whole thing, just, we're going to try and make as little cuts as possible. Alright. We able to get some good shots? Is the student able to see this? Able to expose?
As you can see, that's the cerebral plexus tissue.
Yes, it is.
It's very fragile. You gotta be careful.
A few more cuts.
Or else the patient could die.
As you can see, our voice box is right here. We just breached it. So this is a blue and white variant of the voice box right here, as we expected during our research.
Yep.
So with this, we should be able to crack the voice box. Crack is a strong word, but we should be able to resect the voice box.
The voice box.
Yes. So what I'm gonna do is I'm gonna make a cut kind of along this side right here, because this side will be a little harder to stitch up. So I'm just gonna keep going along the seam we already created over here. Trying to go along with the anatomy. And after we have enough exposed here, Dr. Braden is gonna be the one that actually takes out the voice box for us.
With my tweezers.
Yes. So I'm just gonna make a little tiny bit more room.
I think that's enough room. From my personal, professional perspective, I think that's enough room. Thank you.
You're welcome.
I'm right-handed, so I do this. All right. These are bigger than the diameter of the thing. It doesn't fit around it. I don't think we thought about that.
Just to kind of maneuver it out, because we can use our hands to take it out.
Yeah, I knew that. Oh, yeah, I'm gonna do this.
You want me to retract for you?
No.
Alright.
I don't know what that means. Oh, like that. Yeah, I'm gonna just pop you out.
That's sterile. Alright.
Okay.
Electrochemical cell. The articular system has been exposed.
You need
Alright.
a screwdriver?
So, this seems to be a different model than I expected. Alright.
So you mean the patient's gonna die?
Nope, nope, Braden.
Oh.
Alright. I'm going to scrub out real quick. I need you to talk about the case on this video. I'll be right back, okay?
Are you scrubbing out to find a screwdriver?
I am.
I got my bare hands.
Braden, you're scrubbed in so far. You can just inspect the voice box real quick.
Yeah. So basically, this is the voice box. It replays the sound of the bear. And this is the thing that's not working correctly. So our job is to replace the insides of this, get it working good as new. Yeah. I think I could just pull this off if I wanted, but I might break it. And there's like some kind of screws right here. But I think you're meant to just like slide it somehow. BAB, that stands for Build-A-Bear. That's what that means. And it's a paw too, it's pretty cool. There's the little noise that comes out of there. It was made in China. That's pretty cool. Learning about Jahivis' origins now. He was made on January, February, March 20th. Jahivis was made. So far the surgery's going pretty good. Probably will make it. I think it's gonna live. Yeah, incision right here. Later on, we're gonna stitch this back up. Put a few stitches on here. Good as new.
Got a sterile instrument right here. Only the end is sterile right here. Dr. Crace, can you glove me back up?
Yes. With new gloves?
Yes. Can you put that in a sterile field?
It is. I cleaned all this before you came, so it's all sterile.
What is this?
That hand. Perfect.
That was perfect.
You know, they should hire me to do this.
You said what?
They should hire me to do this.
You should not perform surgery.
Professional glover.
Alright. So, what we're going to do is we're going to have to open. This is a more invasive surgery than anticipated, so we are going to have to open the electrochemical cell.
We're going to have to crack it open.
What we're going to do is we're going to put
Hopefully
the
his heartbeat
screwdriver.
stays.
We're going to have to kind of just wiggle it off. Right there. You see that right there?
It popped.
It pops up.
Once you hear that pop, that's your signal.
That is your signal right there. We get in this? A lot of good stuff. This is the most exciting part of the surgery. Well, we're about to start the most exciting part of the surgery. Alright. So now we've exposed the electrochemical cells right
We can
here.
see the circuit, we can see the batteries.
Yes, we can.
That's when we're going to need these.
Yes.
Energizer 357 battery.
Alright. So what we're going to need to do is they did a really good job of making this difficult for us to get right here. Okay, so we need to expose. I said dang. Okay. So we are going to need to open up these clips right here to allow these electrochemical cells to slide out. Alright? So I'm going to come over here and attempt to slide these out. Alright. Try to get these out. And my doctor will do the other side of this operation.
Looks like you're struggling there, buddy.
I'm not struggling. And there we go. Bada bing, bada boom. We need to make sure that we keep the broken electrochemical cells separated from the old ones. So I'm just going to get this loose a little bit more. Like this. There we go. We have resected one of the defective electrochemical cells. Based on my observations, yes, there's definitely some use and a little bit of acid buildup on this end right here, meaning that it was definitely time for it to go. So, Dr. Braden, do you have...
smell.
Yeah? Dr. Braden, do you have the other electrochemical
Yes, I do.
cell? As you can see, this one is much newer and has no staining on it. So I will just insert the electrochemical cell like this. Just like that. Now the left side, Brayden, can you confirm that the left side has been completed?
It has been completed.
The left side has been completed over here. And now my resident will perform the right side.
Yes.
Did you pay attention?
Yeah. I took notes.
Are your AirPods in during surgery?
No. They're not.
Alright, here we go. We are gonna do.
So what I saw
We
was...
did the left side, so we're gonna do the right side. We basically have to kind of poke this area out over there. So I can grab one of our sterile instruments over here. It's maybe a little easier to do this.
Yeah, I'll use that one. I was just using one of these.
Pretty well so far. Dr. Chris?
This one.
Where is the defective
This
one?
is the defective one. I can tell by the left on.
Yeah, that is not sterile right there, so.
I don't think you were paying attention.
We're gonna do the flat side up. You're just gonna slide it in. Flat side up. Is the flat side up?
Hope so.
Alright.
Moment. We can test it right now. See if it's working. Still very quiet.
It works. No, that's the volume it was. That's the volume it used to be at. That sounds like a full recovery right there.
The patient will be making a full recovery.
The patient, based on this observation right here, the new electrochemical cells have been successfully transplanted. Now what is left for the procedure is to put together the auricular system and transfer it back into the patient and suture him up. So, Dr. Brayden, would you like to do the honors of closing the electrochemical system? You just kind of got to snap the back part. Boom, like that.
This is going back inside that bag.
Yes, it is. Yep. So this is functioning right now. So now what we are going to do is we're going to insert this back into the patient, like so. We're going to make sure the speaker is facing the side where the fluff is not most present, so it will be most audible. Just like this. All right.
Last thing is to suture the skin.
Do you have the
tissue
sutures?
Back up. No. Do you?
I don't have the sutures. I have.
I'll get them.
All right. I need you to go back into the patient's room real quick and get the scissors. You got all this, right? Did you watch the insertion right here? So as you can see, let's just do a quick anatomy review. So since this part right here isn't as thick, we want to make sure that the voice box is sticking out this way right here, facing us. So when the message is played, it won't be buffered by all the fluff that's on the thicker paw area. Thank you, Dr. Brayden.
You're welcome.
So I will begin the suturing part of this, and then you can finish off. That was my practice.
Oh, did you do this like right before we started?
No, I did it earlier.
No. And I'm sure you remember how I taught you to do this, so I'll leave it to you, Brian. Very confident in my teachings.
Yes.
You couldn't tell.
I'm glad.
Yeah. Yeah, harder than it looks, right?
No, this is probably the hardest part right here.
What a dentist sounds like.
Oh, yeah.
Yeah.
And I always like to make the string much longer than I think I need, just in case. There we go. No, don't do that, don't do that.
Make sure it's alive.
Thank you, Dr. Brayden.
Staying alive. Stand up.
Probably too long right here. Needle. This is sterile. I like to use this as an anchor point right here. Whoa!
Go above me.
Whoa! Here we go. So what I'm gonna do is I'm gonna create the knot.
You got this.
You proud of me?
Yeah. Just like I taught you. There's a reason I'm a world-renowned teacher.
And surgeon. Good, dude.
We're going for the third one.
I like to do 3 to 4, especially for surgeries.
I told you about that.
Yes, you did. I learned from the best.
Sure did.
These
You know who taught me?
Who?
Myself. I'm just that good.
You're the first surgeon ever, huh?
Yep. I taught all the teachers.
This probably isn't the most exciting surgery, but then we are going to close up the skin very soon. Alright, that's looking... I'll do one more just for safe measure.
Okay.
There we go. I'm gonna start down here. Boom. Dr. Braden, where are you?
I'm right here.
I'll make this a really neat
You gotta be
stitch.
very careful with this part. Because the better the stitches, the less the scar. And the better it'll heal, less chance of infection. All that caboodle.
Yes.
Flawless technique, just as I taught.
I'm glad our resident is over here, very confident.
Yeah. As always.
That's good.
Never lost a patient before. Never will.
That's good.
40 years of practice.
And as we can see, this stitch is holding up very nicely down here, so we're just going to continue. Still dancing to the sounds of the audio, Dr. Braden?
Yeah. They really know how to make a heartbeat. Get it? Super lively beat.
Dr. Braden is always been one of our funniest residents, comedically gifted residents.
You almost done with that suture?
We're getting there, we're about halfway done. Look at that.
Looking good as new.
I
Gonna be
know.
sounding good as new too.
I just want to make sure that tangle's all gone. Just Cross down here. So a little bit more. Oh, you want to do any? Or are you good?
No, you're good. Keep going. You're doing great.
You're like, I already know how to do it. I don't need-
Fantastic, yeah. I can do this with my eyes closed, basically, at this point.
I'm sure you can.
Muscle memory. You might get there one day.
I hope so.
It's a might. Like a very... Like, I say might, but it's like very low chances, but it's still a might.
I would love to be at your level one day, Dr. Braden.
You want my autograph after this?
Huh?
You want my autograph after this?
I do.
Okay. I could get a tattoo gun if you wanted that. So it's like permanent. Would you like that?
I'm all good, but thank you.
That's good, for sure.
Huh?
Huh?
Nothing.
That's looking pretty good.
It's looking very good. Look at that.
Good
OR3, what is going on? Alright. I'm gonna do a very tight tie real quick. Make sure we are looking all good. I need to go through the skin real quick one more time. There we go. Student, this is looking good right here?
Yeah, looking fantastic. Did you call me student? You mean teacher?
You said what?
Teacher, you mean?
I'll check in the students, see if they like it.
Oh,
Can you make a cut right here, please?
Yes, I can. As close as I can get.
Look at that.
Couldn't even tell there was a surgery done.
You cannot.
Flawless procedure.
You do a very tight tie. You see, scissors. Can you cut about right here?
Yes, I can.
Thank you. You're done with this. Just trying to get this knot all the way down here. Trying to make it a little bit bigger. This is probably the most delicate part of the surgery. I always like to make it look like this surgery never happened. The hole wasn't very good, so I'm just gonna try one more time. You can't even tell there are stitches right here.
No, you can't.
You literally,
Flawless.
you taught me the best.
Exactly.
What's his vitals looking like right now?
Stable.
Stable?
Yep.
Awesome. Yeah, this is probably the hardest part of the surgery right here. Just make it travel all the way down there.
Looking fantastic.
Look at that. Clean as a whistle. And minimal fur loss as well. That's all we lost.
Time to bandage. So this part just make sure everything stays in place. Make sure.
Are you wanting to bandage
feels
it?
yeah. Give some of that bandage.
Yeah, you might want to just kind of focus on the arm right here.
Yeah. So basically, this is just making sure everything stays snug, keeps everything together. And it just makes it so the patient stays healthy.
Try to get a little bit more up in this area right here.
Oh yeah, trust I am.
Thank you for recording this. We really appreciate it. This will be really good for medical history right here.
It's great we can share us saving lives with other people.
Yes. Overall, the procedure's only taken like an hour.
Yeah. Estimated 10 minutes? Alright, come over here with that tape. There we go. One more piece and we're done.
One more piece. Let's get this son of a PI to pack you. Let's go. Let's go.
Good job, everybody.
Woo! You gotta do the glove fling. Woo! Boom! Woo! Give me some high fives. Woo!
Surgery was a success.
Surgery. Wow, that was a phenomenal display right there. All right, let's get him to the PACU.